pleased to be joined by Duke Professor Wylin Wilson, author of Womanist Bioethics, Social Justice, Spirituality, and Black Women's Health, which I'm excited to discuss some of the themes from. But first, I want to thank you for joining us today.
Thank you. It's fantastic to be here.
Yeah, and the pleasure is all ours. And I want to start with kind of the crux of the book, bioethics. It's in the title. Could you describe what bioethics is as a field? And then could you detail some of the shortcomings or failures it's provided Black women, specifically with their healthcare outcomes?
Yeah, thank you. So, bioethics actually is the study of ethical questions that arise in either medicine, science, or technology. And the I'm glad you asked about the shortcomings. The major shortcoming is that it's been really from one perspective historically, right? It has, as a field, it developed in the late 20th century, and it focuses and has focused mainly on white male experience and has therefore marginalized the experiences and the voices of women and other vulnerable populations, whether it be immigrants, whether it be LGBTQ plus individuals. So yeah, it has basically been very myopic, right? Just yeah, focused on white male experience.
And what are some of the, I guess, outcomes we see from that? I know you spoke to, I think it was like a higher mortality rate for Black women and things like that. Or there's some other kind of disparities that we see commonly?
Yes, yes. Actually, one of the things that is really important to know and that my book talks about is the fact that Black women, more than half of African American women 20 years or older, have hypertension. Heart disease is the leading cause of death for African American women. They're more likely than white women to be diagnosed with diabetes. And Black women are understudied. They're understudied population in healthcare and suffer from lack of access to quality healthcare and mental health care, which is really problematic. So that's one of the reasons why it was important for me to write this book so that we really could help to get at these issues and get at them on a really important level.
And before we get into what the womanist approach is and how it would look, and maybe how your background in theological ethics helped shape this, can you dive into maybe for viewers the why, like why we see these kinds of disparities from not seeing more Black female voices in bioethics or healthcare? Like, how can this lack of representation affect those that aren't being represented?
Yes, yes. One of the reasons why is particularly because of how the field itself developed, right? So bioethics was largely something that developed from, say, the debates that were going on between some of the religious scholars. There were some priests who were debating, theologians were debating these issues of suffering, end of life, beginning of life. And so the folks that were actually in these conversations and having these dialogue were middle class to upper class white males, and women were locked out of, particularly during this time, locked out of these conversations. And so that's one of the main reasons why you do not hear these voices, and not just women, but definitely folks who are minoritized, including folks from African American communities, Asian American communities, Hispanic, communities. So that is really what was significant about me wanting to definitely take on this project and write this book.
Yeah, so then diving into, I guess, maybe some of the remedies for this, what is the womanist approach that you discuss in your book? And then how does your theological background fit into and help shape this?
Yeah, yeah. So my book, this approach to this womanist bioethics, the reason why I wanted to make sure that I did this project is because I wanted to focus on social justice, spirituality, and Black women's health crisis here in the United States. And so this book shows you that Black women fare worse than others across almost every health indicator. So we don't need to just include Black women in the bioethics, conversation and practice. We need to center these voices, right? Center these experiences, particularly because I also show how Black women's bodies have been devalued throughout history, particularly in medical institutions, but also in religious institutions, right? And so this book is really helpful because it creates this space for this conversation about how race, gender, health, and spirituality are really important considerations when it comes to health disparities. Mhm.
So I'm curious then whether it be churches, the religious community as a whole, or just theological traditions themselves, what role do they play in addressing these kind of systemic disparities we see in health? And then what additional roles could they take on moving forward?
Oh yeah, for sure. So these Black churches and Black faith communities have a long history in public health activism. And I talk about this a bit in the book as well, because African Americans have suffered from health disparities since the beginning of this nation, right? But however, the role of these faith communities, the role of churches, it has to be critiqued, right? Because my book definitely examines the practices within these faith communities that have a historical role in the well-being of Black women, but faith communities, they're really important, but they also have to be accountable. And that's what's really important about womanist methodology, is that womanism allows for that kind of critique, right? Holding not only our religious institutions accountable, but holding one another accountable in society as well. Yeah.
So what are some of the actionable steps that you think needs to be taken to start eroding away from these disparities? I know, like, we've talked about representation. What do you think are some of the things we could do even to mobilize the Black females themselves to want to be the representation that they need?
Yes. So yeah, one of the things that has been really powerful is talking about this kind of this caring legacy that we find in Black churches. One of the things that has worked really well is there is something on the program. So when you go in church, you get the programs, right?
Mhm.
And it's going to tell you what's going to go on when and who's going to do what. And so what's really nice is there's a little segment of the program that's called the sick and shut in list, right? And this is it's been going on for a while in Black church tradition. And this list that's in the church program is really important, because this is one of the ways that people kind of really live into that caring, that legacy of care. And so in my book, I talk about, sick and shut-in women as women who are living with chronic health conditions, or in poverty, or experiencing food insecurity, health disparities. And Black churches, they have on these lists folks that are also, maybe they're in the hospital, maybe they're bereaved, in prison, in rehab. And these are people that are in need of prayer and care, right? And so the list is a call to action. When you see that list, some of them have phone numbers on there. So it's the call to action to go beyond just praying, because a lot of folks will say, oh, I'll pray for you, or let me pray for sister so and so, she's sick. But sister so and so also may need a meal, or may need somebody to come and cut the grass and all that. And so that's what's really powerful about, what goes on in these faith communities, is that people really do mobilize themselves, and a lot of churches actually have committees. Some of the churches call them deacons. Some of them call them a mission society, but they are folk who are mobilized. I call them the foot soldiers, right? These are the foot soldiers who actually respond to the needs of the community. But Black women in these Black churches have been foot soldiers in responding to the interaction of racism and healthcare as well. So some of them helped to start Black hospitals during the time of segregation. Some of them helped to, start the Black medical schools and nursing schools when Black physicians and nurses were locked out of, the mainstream white medical societies and schools. So there are many ways that people can mobilize themselves, and have throughout history. So
what was the most shocking finding for you through your research of bioethics, through the disparities that we see? It could be like a story, it could be a particular like statistic, or part where the disparities exist. I just like asking people who have done extensive research on a particular thing, like, was there any moment that really like blew your mind? Because then I'm sure it's going to blow others' minds who hasn't done nearly as much research.
no, I hear you. So I will say it's interesting. So I'll say it's not that it was most shocking, but I'll say what impacted me the most, what really impacted me in the research that I did for this book, was the stories of enslaved persons. Because my claim in the book, a really important claim that I make, is that bioethics actually begins in the womb of enslaved Black women in this country. Now, that's not going to be the origin story that you're going to get
Yeah.
for mainstream bioethics. But for me, it is an important part of the story of bioethics, because when you look at, I have a story about an enslaved woman, Adeline. She was a breeder. A lot of the women were breeders, right? Particularly when slavery, the transatlantic slave trade, was outlawed, right? So then that's when a lot of the breeding, rapes and whatnot of women was really happening, of enslaved women. And so as I'm digging and reading these stories, and reading about I call it the Jim Crow health history in the United States, because, we always talk about, Brown versus Board of Education, when we had the desegregation of the education system, but we don't really talk about when our hospitals were actually desegregated. And that was 10 years later. So it wasn't until the 1960s, right, that our hospitals and medical facilities, public hospitals, were desegregated. So reading these awful stories of how Black folk had to sit outside of a white hospital, and wait until all the whites were served first, right? And then you can finally go in and get care. And then there were other stories that I uncovered. One was the dean of students at Fisk University. This was in 1931. Was traveling, got into a car accident, and suffered serious wounds, actually fatal fatal wounds, and of course was turned away from the White Hospital and ended up dying, right? So, and this was, I mean, there were so many of these stories. So I did a quite bit of shedding tears as I was doing my research for this book, because it really is just, yeah, it's pretty heavy. It's some heavy stories when we look at our Jim Crow health history in this country. So I think that was the most impactful thing for me, was uncovering those stories. Yeah, yeah.
It sounds impactful indeed, definitely. So yeah, for those who might want to learn more, read more when the book comes out, share where they can get it. You can let them know the name again. If there's any other exciting things coming up revolving around it, go ahead and shout it out.
Yeah, thank you so much. Yes, so my book is Womanist Bioethics, Social Justice, Spirituality, and Black Women's Health. And one of the really exciting things that's coming up around it is that I do a case study within the book. One of the case studies is on Black maternal health. And so what I'm doing this January, toward the end of January, the 31st, we're going to have a Black Maternal Health and Black Church Forum. And we're going to have it here in Durham, North Carolina. We're bringing together pastors, doulas, midwives, clinicians, you know, so we want everybody sitting at the table, right? So that we can strategize. So it's not just, you know, just your regular conference where we're just talking, but we really want to strategize about what can we do, how can we come together and work together to really combat the Black maternal mortality rates in this country that are really just devastating. So
And then where should people go if they want to get the book?
yes, so it is available on Amazon. It's also available on Barnes and Noble's website as well, and the New York University Press website. So you have three places where you can go.
Awesome. That is plenty of options, right? All right. Well, hey, thank you again for speaking with us. I appreciate you sharing your knowledge with us, and I'd love to have you back on again in the future.
Fantastic. Anytime, just let me know. Thank you so
Awesome.
much.
Enjoy the rest of your day.